Incorporating motivational interviewing into care coordination requires a patient-centered approach that emphasizes collaboration, empathy, and empowerment. Here are some practical strategies for incorporating motivational interviewing techniques into care coordination. Establish rapport and build trust. Begin each interaction by establishing rapport and building trust with the patient. Greet the patient warmly, use open body language, and actively listen to their concerns without judgment. Express empathy and understanding toward their experiences and feelings. Assess readiness for change. Assess the patient's readiness for change by exploring their attitudes, beliefs, and motivations toward behavior change. Ask open-ended questions to elicit the patient's perspective on their health goals, concerns, and challenges. Use reflective listening to validate the patient's feelings and experiences. Explore ambivalence and discrepancy. Explore the patient's ambivalence toward change by discussing the pros and cons of their current behaviors and the potential benefits of making positive changes. Use reflective statements to highlight discrepancies between the patient's current behaviors and their health goals or values. For example, it sounds like you value your health, but you're concerned about the impact of smoking on your breathing. Elicit change talk. Elicit change talk by asking open-ended questions that encourage the patient to express their motivations, desires, and reasons for change. Listen for cues of readiness to change, such as statements of commitment, confidence, or intention to take action. Use affirmations to reinforce the patient's strengths and efforts toward their behavior change. Collaboratively set goals. Collaborate with the patient to set realistic and achievable goals that align with their values and priorities. Use these SMART criteria: specific, measurable, achievable, relevant, and time-bound to guide goal setting and action planning. Encourage the patient to take ownership of their goals and identify concrete steps to achieve them. Explore barriers and solutions. Explore potential barriers to behavior change, such as lack of knowledge, resources, or social support. Collaborate with the patient to identify solutions and strategies to overcome these barriers. Use affirmations to reinforce the patient's strengths and resilience in facing challenges. Support self-efficacy and autonomy. Support the patient's self-efficacy and autonomy by affirming their ability to make positive changes and take control of their health. Encourage the patient to identify their own strengths, resources, and past successes that can support their efforts toward behavior change. Use affirmations to acknowledge the patient's efforts and progress. Normalize relapse and setbacks. Normalize relapse and setbacks as a natural part of the change process. Encourage the patient to view setbacks as opportunities for learning and growth rather than signs of failure. Use reflective statements to explore the patient's responses to setbacks and reinforce their resilience and commitment to change. Case example: integrating motivational interviewing into care coordination. Consider a hypothetical case example of integrating motivational interviewing into care coordination for a patient with diabetes. John, a 55-year-old man with type 2 diabetes, has struggled to adhere to his prescribed diet and exercise regimen. During a care coordination session with his nurse care manager, John expresses frustration with his lack of progress and difficulty maintaining healthy lifestyle habits. The care manager uses motivational interviewing techniques to explore John's ambivalence toward behavior change and collaboratively identify strategies to support his health goals. John, I hear that you're feeling frustrated with your progress in managing your diabetes. Can you tell me more about what's been challenging for you?
Yeah, it's been tough. I try to eat healthy and exercise, but I keep slipping up. I feel like I'm not making any progress.
It sounds like you're really motivated to take care of your health, but you're struggling to stay on track with your diet and exercise. What are some barriers or challenges you've been facing?
Well, I work long hours, and it's hard to find the time to cook healthy meals or exercise. Plus, I have a sweet tooth, and I find it hard to resist sugary snacks.
I understand. It sounds like time management and cravings for sugary foods are significant challenges for you. What are some strategies you've tried in the past to overcome these challenges?
I've tried meal prepping on Sundays and going for walks during my lunch break, but I always seem to fall back into old habits.
It's great that you've been proactive in trying to make positive changes. Let's brainstorm together some new strategies that might work better for you. What are some small, realistic steps you could take to improve your diet and increase physical activity? By using motivational interviewing techniques, the care manager empowers John to explore his ambivalence toward behavior change, identify barriers to adherence, and collaborate on actionable strategies to support his health goals. Motivational interviewing is a powerful communication technique that can enhance patient engagement, promote behavior change, and improve health outcomes and care coordination. By adopting a patient-centered approach that emphasizes empathy, collaboration, and empowerment, care providers can effectively integrate motivational interviewing techniques into their practice and support patients in achieving their health goals. If you're interested in learning more about care management, you can find more information on our website at the links below. Please click like and subscribe. Thanks for watching.